we'll talk. Hello everyone, can you see me? Hi everyone, can you see me? Am I audible? Am I visible? I'll just check my sound. Can you see me? Yes, I can see myself, and I think all of you can also see me. So all of you, can you just write hi in the chat box? And so how was your pediatrics today in the INICET? So today there were at least 20 questions from pediatrics. So all of you, there was no doubt that they were straight away from our notes, straight away from our back to basics classes. There were at least 20 questions, and I'll discuss those questions. So how was your pediatrics, everyone? So in the meanwhile, everyone joins. You can tell me how it was. And then we'll start discussing questions. And see, I don't know the exact options, so I want all of you to tell me what were the correct options. So I have collected the questions from all of your recall, and you tell me what were the questions in your exams. So we'll wait for a minute more. You can just type in the chat box how it was. Yeah, I know there's someone in the chat box saying that there were questions from TND. So every TND, every DVT, every class, this is what I told you, कि यही आपके exam में आएगा. So there is no doubt that these are the kind of questions which come in your exam. So guys, you have to stick to the basics, and your basics are, first of all, your back to basics collection. So whatever videos, we have posted very small videos, like maybe just a 15-minute video on IV fluids, and this is what came in your exam. In every class of yours, I discuss about dehydration, I discuss about diarrhea, IV fluids. यही सब आता है आपके एग्जाम में. So before you go for your NEET PG also, look at your DVT sessions, look at your PYQ sessions, PYTs, and revise. Okay, so don't go for new stuff, just revise your B2B, revise your DVT, and यही question आएगा. मैंने in fact I told you, I posted a video on Instagram that Kawasaki disease पे सवाल आएगा, and आया. And I always tell you, last week I posted on Instagram about HSP, and a question was there on HSP. So guys, this is what comes in your exams, and you have to revise that. Chaliye, let's start from the first question. So all of you, there was a question on Downy scoring, and the question was multiple options correct. And these were the 4 options. So are you happy with the options which came in your exam, all of you? So these were the options. Respiratory rate, cyanosis, feeding, grunting. Anything else you want to say about this question? So all of you, in your back to basics, I have made a special video on respiratory distress. And even in your classes, when we talk about neonatology, at least 1 hour we talk about respiratory distress. And I always tell you, guys, याद रखो कि exam में वो Downy scoring नहीं पूछेंगे. They will ask you the parameters in the Downy scoring. So you should know respiratory rate, cyanosis, retractions, grunting, and air entry in the mid-axillary line. So remember, in newborns, it's air entry in the mid-axillary line. So the answer was respiratory rate, cyanosis, and grunting. Okay, cool. चलिए आगे चलते हैं. And let's take you to the next question, and I want all of you to tell me the 4th option. So the question was, Insure is used in. And can anyone tell me what was the next option? What was the next option, all of you? Insure is used in RDS in newborn, birth asphyxia, neonatal jaundice, anything else? And I will just write that for you. So let me know, all of you, what was the last option? Cyanotic spell. Okay, so someone is saying one option was cyanotic spell. So okay, so there is no doubt that Insure is used in RDS. So again, देखिए respiratory distress से एक और सवाल. In our class of respiratory distress, if you look at the video of Back to Basics, you'll find that I have told you the whole approach of how to manage preterms with RDS. So if you have a preterm with distress, if you fail CPAP, we give intratracheal surfactant. So you intubate, SUR stands for surfactant, and as soon as possible you extubate back to CPAP. So you extubate him back to CPAP. Okay, so you're right. Every one of you is right. So all of you know and knew that Insure stands for intubate, giving surfactant and extubate. Okay, but remember आने वाले exams में याद रखिएगा about Lisa and MIST. आगे अगली बार वो लीजा एंड मिस्ट पूछ लेके फिर आप कहोगे ये क्या होता है. So there are less invasive methods of surfactant administration. Less invasive or minimally invasive surfactant therapy. Less invasive or minimally invasive surfactant therapy. So remember, they may ask you this word, but remember, Insure is the standard of care. Lisa and MIST are new ways of giving surfactant. Okay. Now there was a question on Strep A galacticae causes. Now, all of you, can you please tell me what exactly were the options and what exactly was the question? See, I told you in each and every class of yours कि वो पूछेंगे आपसे ग्रुप बी स्ट्रेप्टोकोकस से क्या होता है. Last INICET में there was a question on group B streptococcus causing neonatal meningitis. Okay, so anyone in the class, what was the exact question and what was the exact options? Strep A galacticae causes what? So this was the question. So all of you, can you tell me what was the options to this question? Anyone? We'll wait for you to tell me the exact options. Just 1 second. Okay, same options. Someone is saying biofilms. Let's see. Dental caries. Someone is saying one of the option was dental caries. Biofilm with dental caries. Okay. Biofilm with dental caries. Okay. And I think this pharyngitis with tonsillitis was a single option. Pharyngitis with or without tonsillitis. It was like this. Okay. So all of you, I have told you in each and every class of yours that group B strep is the most common cause of neonatal meningitis and sepsis worldwide. So Nelson's का जो current issue है, which is the 22nd issue, which just came this month, वो भी यही कहता है. Okay. C and D mixed as single option. So everyone is right. So we have the correct options here. So there is no doubt कि neonatal sepsis का most common cause is Strep A galacticae. However, all of you should know, my question to all of you is कि कहीं ये multiple option correct question तो नहीं था. Was it a multiple option correct? This was group B streptococcus, Dr. Sharaf, not group A beta. Okay. They asked group B strep. So remember, adults may be group B strep can cause problems in pregnancy, in immunocompromised patients, it can even cause bacterial endocarditis also. Okay. So what was this question? Single option or multiple options? Single option. Okay. So if it's a single option, of course, the answer is, there is no doubt, the answer is neonatal sepsis. Now all of you should know that serotype 3 is the most common cause of neonatal sepsis. Serotype 3. Okay. एक बात और add कर लो. Okay. So since you have told me the correct options, I will use those options and I will add them here, and I will tell you that the answer was, of course, neonatal sepsis. Okay, चलिए आगे चलते हैं. Let's go to the next question. Now there was a question on which hormone is not needed for in utero growth. Which hormone is not needed for in utero growth? So I don't know the options, guys. So can you tell me the options? Let's add options to this question. Which hormone is not needed for in utero growth of the fetus? Of course, we know growth hormone is not needed. So, okay, one option was insulin. Insulin-like peptide. Thyroxine. IGF. Okay. So of course, growth hormone is not needed. And if you look at your back to basics, if you go to your short stature lecture, we clearly say growth hormone deficient babies are born normal because growth hormone is not needed in utero. Okay. So there is no doubt the answer was growth hormone. Okay. चलिए आगे चलते हैं. Let's take you to the next question. And someone is saying IGF-1 was the option. I'll just improve our options. Okay. So growth hormone was the answer. Now again a question on short stature. And every class of yours, whenever we talk about endocrine system, हम short stature के बारे में बात करते हैं. और हम बात करते हैं about disproportionate short stature. So question है, which of the following has a shorter upper segment? Hanji. So which of the following has a shorter upper segment? In which of the following this ratio is reduced? So here is a disproportionate short stature. 13 years pe upper to lower segment ratio should be around 0.9. His ratio is 0.8:1. So yeah. So in every class, we discuss about disproportionate short stature. So I discussed about, disproportionate short stature in all of your lectures. And this is one of our back to basics lecture of short stature. And you can see in mucopolysaccharidosis and spondyloepiphyseal dysplasias, this ratio is reduced. So on your screen, all of you, I'm showing you a child. Okay. Thank you, Neha. It was a 15-year-old child. Neha is saying 15-year-old. Thank you. So you can see a child of spondyloepiphyseal dysplasia, जिसका upper segment छोटा है. So this is a 15-year-old child. Thank you, Dr. Neha. So the answer of this question was a disproportionate short stature spondyloepiphyseal dysplasia. All of you happy with your answers? Okay, someone is saying growth hormone deficiency was also one of the option. Okay. But there's no doubt that this child's upper segment lower segment ratio is smaller for his age. Okay, I will add. Thank you. So growth hormone deficiency was also one of the option as per Dr. Geeta and Srijani. Growth hormone deficiency. Okay. But there's no doubt that this child has a disproportionate short stature. Upper segment is small जैसे कि मैंने आपको सब क्लासेस में बताया अबाउट मॉर्की सिंड्रोम, सो म्यूकोपॉलीसैकेराइडोसिस एंड स्पॉन्डाइलोएपिफिजियल डिस्प्लेसियाज। सो इसमें जो दो ऊपर लिखे हैं, इनमें द रेशियो इज इंक्रीज्ड even in rickets. In growth hormone deficiency, it's a proportionate short stature. Okay, now खुशी, thank you, 145 centimeter height भी बता दिया खुशी ने, very good, 145 centimeters height, thank you. So I think our question is complete. Can we go further, all of you? Can we go to the next question, which came in your exam today? Okay. Now, again, growth and development. So we just talked about short stature. So there was a question on head circumference increases in the first 3 months. What is the rate of head circumference increases? Am I right? ऐसा question था exam में? Head circumference increase in the first 3 months. So all of you, in your back to basics, in the growth lecture, I talk about exactly the same. That question was in the first 3 months of life, okay? So remember, in the first 3 months of life, head circumference increases at the rate of 2 centimeter per month. हमने आपको क्लियरली आपकी सब क्लासेस में ये बात बताई, whether it was a live lecture, online lecture, recorded back to basics lecture, it was everywhere. Now someone is saying the options were 0.5, 1, 2 and 4. Lovely. चलिए, let's improve our options. So 0.5, 1 and 0.5, 1, 2 and 4. Okay, 0.5, 1, 2 and 4. These were the options. Cool. And the answer was, of course, 2. ठीक है? So I've told you this in all of your classes. Happy? Can we go further? चलिए. So the next question was on, again, diarrhea, dehydration, IV fluids. We always cover in our classes. And I have discussed at multiple platforms about what should be the ideal maintenance fluid. So all of you, अभी भी टाइम है, जब भी आप NEET PG के लिए जाए या INICET के लिए जाए, look at our back to basics lectures. Okay, they are not hours of lectures. Like maintenance fluids का lecture सिर्फ 15 मिनट का है. And देखिए, classically सामने लिखा है आपके. The ideal, according to American Academy of Pediatrics, after 3 months of life, the typical maintenance fluid for children is dextrose with normal saline. 5% dextrose with normal saline. Okay? Avoid hypotonic fluids in children. Remember, in maintenance fluids, we avoid hypotonic fluids. N by 5, मैं अपनी क्लास में बोलता हूँ, all of you, N by 5 is poison. Don't use N by 5. If any of you marked N by 5, it is poison. Okay, so N by 5 में P stands for poison. Okay, because in children now we use 5% dextrose with normal saline as the maintenance fluid, जैसे adults में करते हैं. Okay, so this has changed according to the Indian Academy of Pediatrics and the American Academy of Pediatrics also. Cool, all of you? Cool. Can you just type in the chat box so I can take you? Okay, someone is saying 10% dextrose with normal saline. I have written here. Now 10% dextrose I would use in someone like a liver failure patient. In liver failure, you know, these patients are hypoglycemic. So I would like to give them maybe 7.5% dextrose with normal saline or a higher based on the patient. Okay. Okay, so we are right. Lovely. Now this question I want to ask you guys. ऐसा सवाल था एग्जाम में on nutritional rickets. What is not seen in nutritional rickets? ओके, आप कह रहे हैं n/4 भी था, n/5 भी था, ठीक है, चलो n/4 भी लगा देते हैं, n/5 भी लगा देते हैं, n/2 भी लगा देते हैं, ठीक है, आंसर तो वही रहेगा. ओके, थैंक यू. ओके, सो व्हाट इज नॉट सीन इन न्यूट्रिशनल रिकेट्स? Guys, this is how I made the back to basics content of DAMS. It includes everything you need for your exam, and it is, in fact, it is not like 2 hours of lecture on rickets. It is just a 30-40 minute lecture which includes everything. And I'll just show you that in my lecture, this is a table. How do you differentiate types of rickets? Especially resistant rickets. You think about nutritional, vitamin D dependent rickets, hypophosphatemic rickets, and chronic kidney failure, and we now call it as CKD MBD, chronic kidney disease in mineral bone disease patients. Lovely. So now someone is saying urine calcium creatinine ratio more than 15. That's very, very high. Anything else? Is the options, this was the exact options which came in your exam? So of course, देखिए, अगर typically, listen to me carefully, which I told you in all of your classes, typically nutritional rickets is calcipenic rickets. उसमें calcium usually कम होता है, but because of the secondary hyperparathyroidism, our body maintains the calcium. Okay, so अगर बॉडी को कैल्शियम मेंटेन करना है तो यूरिन में कैल्शियम हाई नहीं होगा. Okay, so body will restrict the calcium. So there is no doubt that your body will restrict. So this ratio will be low. So remember, typically in rickets in children, they do not have hypercalciuria. They retain calcium. And remember, serum calcium is always normal because of secondary hyperparathyroidism, which we spoken in all the grand rounds. In DAMS we have clinical grand rounds, we have the PYQ sessions, grand tests. In all of these, I have discussed this at multiple platforms, and of course in your classes also. Okay, let's go further. Another favorite endocrine question of mine. CAH. हर क्लास में बात करते हैं हम इसके बारे में. CAH. Now can you tell me the exact options? Guys, please tell me the exact question and the exact options. So yeah, there was a child, a boy with precocious puberty and hypertension. So of course 11 beta is the answer. Okay, because of DOCA accumulation, deoxycorticosterone accumulation, 11 beta is the answer. Okay, someone is saying there was hyperpigmentation. 10-year-old child, okay, has hyperpigmentation. See, अगर cortisol नहीं बनेगा तो ACTH will be high. So this is true. This is fine. Hyperpigmentation is fine. 21 alpha hydroxylase deficiency. Cool. More height with hypertension. So basically, what was it? Height age more than the chronological age? Cholesterol side chain cleavage enzyme. Cholesterol side chain cleavage enzyme deficiency. Okay, BP was 150/90. Dr. Ishan says the child's BP was 150/90. Okay, it was a boy. Okay, boy, BP was high. Okay, so we know this. Secondary sexual characters were mentioned. 17 was not in the option. Lovely. It makes us easier. Because 17 can also have these features. But remember, 17 may, the boys don't get, hypertension can also be seen in 17. Someone is saying 160, 96. Okay, whatever. Okay. BP was high. Okay. So all of you in your lectures also, I have shown you this in multiple lectures. कि जब एग्जाम में क्वेश्चन आए precocious puberty, hypertension, think about 11 beta hydroxylase deficiency. So this is me in the back to basics, and of course the answer is 11 beta. चलो मार्क कर देते हैं 11 beta. Cool. चलिए आगे चलते हैं. Now there was a question, of course there will be a question always on acute malnutrition, chronic malnutrition, acute on chronic malnutrition. बताइए. So before I take you to this question, guys, you should know that our cutoff is always 2 standard deviation. Okay, so our cutoff is 2. So less than 2 standard deviation below the mean of height is called stunting. Okay, similarly for less than 2 standard deviation is weight for height का cutoff. अब यहाँ देखो. Okay, now you tell me the options which came in your exam. I want to know the exact options so that we solve the question. So remember that the cutoff is 2, and for severe the cutoff is 3 standard deviations below the mean. Of course हम देख रहे हैं यहाँ पे कि important यहाँ पे significant जो है वो है weight for age and height for age. Weight for height is not less than 2. So this is not acute. This is only chronic. This child is underweight and has stunting. Was there an option of chronic malnutrition? We can go for chronic malnutrition. And of course, but you're right. If you go for, someone is saying there was an option of moderate malnutrition. Moderate malnutrition. Okay. Acha. But it was moderate acute malnutrition. Now that makes it different because this is chronic malnutrition. पहले से पेशेंट को कुछ था, अभी कुछ और भी हो गया. So a lot of you are saying exactly the same question. So of course I will go for height for age is less. So this patient has chronic malnutrition. Okay, moderate, acute nahi hai. This is not acute. This is chronic malnutrition. Okay. Because our cutoff is 2 standard deviations below the mean. And now here all of you are typing the options: moderate, SAM, acute on chronic, and chronic. Now there's a student, Dr. Sai, in the chat box saying, sir, why not acute on chronic? Beta, our cutoff is 2. This is 1 point, weight for height is 1.7. So this does not satisfy into wasting. This does not satisfy into acute malnutrition. ठीक है ना? So this is chronic. And now all of you, every DVT, every online, my post on Instagram, every time I talk about Kawasaki disease and HSP. So can you tell me what were the options like for Kawasaki disease? It is not acute, Dr. Ninja, Dr. Sidharth. Not seen in Kawasaki. Can you tell what was the exact question like? What was the exact options like? So in all your PYQs, cervical lymphadenopathy. Okay, let us improve this. Let's improve this question. Options: cervical lymphadenopathy. Same options. Okay, cool. Options are right. So guys, in all your classes, every time, all the time, I talk about Kawasaki and MISI, and you can see the conjunctival inflammation is non-exudative. It is non-purulent. Okay. So if we come back to the question, it is not purulent. Okay. Remember, it is non-exudative conjunctival inflammation. So remember, it is non-purulent conjunctival inflammation. And the rash was polymorphic rash. Okay, you're right. Let's make it the typical polymorphic rash, which is seen in Kawasaki. So this option is right. But remember, purulent conjunctivitis is not seen. Yeah, of course, it was an expected question, and so was Henoch-Schönlein purpura. In fact, last week, Instagram pe, I posted a Pediatrics predictor video, और वो किस चीज पे था? HSP पे था. So what are the indications of steroids in HSP? बताइए. Oh. So it means you did not check my post last week and any of my classes. See, in all of my classes, this is a snapshot from the back to basics on the DAMS-eMedicoz, where देखिए last sentence देखिए. In severe pain abdomen, you may give steroids. However, you should look for intussusception. You should try to rule out intussusception. So remember, in severe pain abdomen, you may give steroids. Okay? Lovely. Of course, we should not say HSP because आजकल के ज़माने में हम उसको बोलते हैं the most common vasculitis in children, IgA vasculitis. Lovely. IgA vasculitis. And GI bleed, severe rash. So options हमारी सारी ठीक है. In severe pain abdomen, you may give. And guys, I live in North India. देखो HSP में हर हफ्ते देखता हूँ. Okay, हर हफ्ते. This is the most common vasculitis, and yes, in severe pain abdomen, sometimes we do give them steroids. But remember, you need to rule out intussusception in those patients. Lovely. Now this question you will have to help me, guys. There was a question on RTA, and all of you, in each class of mine, what I do is मैं सबको एक homework देता हूँ, और सबको homework क्या देता हूँ मैं कि all of you have to read the video of RTA from Back to Basics. So in Back to Basics, I have posted a very short 30-minute video. It is a grand round on renal tubular acidosis, and this is what I always tell you. हर क्लास में एक homework भी हम आपको देंगे. So now can you tell me what were the other options? Of course, first option is right. Rickets is seen in Fanconi syndrome because of phosphate loss. और options बताइए. What were the other options of renal tubular acidosis in children? So of course, remember, I told you in your class in Back to Basics that in type 4, either the aldosterone is not being produced or there is resistance to aldosterone. So type 4 में hyperkalemia होता है. Okay. Now here we are getting some options. RTA type 2 with abnormal bicarbonate excretion. So again, in proximal RTA, there is hypokalemia. Okay. RTA type 2 has abnormal bicarbonate excretion. This is true, of course. Okay, RTA type 2 is called proximal RTA. One option was aciduria paradoxical alkalosis. Type 4, hypokalemia with paradoxical. So someone is saying there was an option of hypokalemia with paradoxical. Can you again tell me? I don't think so. You need to check your fourth option. Of course we know second is wrong. उसमें कोई शक नहीं है. Someone is saying phosphate urea was there. Yeah, of course in Fanconi syndrome there must be phosphate urea causing rickets. Or someone has come up with hyperammonemia. Aditya Agarwal is saying it was there. What was there, Aditya? It's true, fourth. Okay, hypokalemia with paradoxical aciduria. Yes, then you're fine. Type 4 is aldosterone deficiency. Okay. There were almost 20 questions, Mandy. So hold on, okay? And everything was covered. We are just revising, Mandy. Don't just be patient, okay? Hypokalemia with paradoxical aciduria and type 4 RTA. So, yeah. This is wrong. Okay, so remember type 4 RTA does not have hypokalemia. Okay, so this second statement is wrong. Okay, let's go further. So there was a question on, so now we don't have a lot of questions left. Spastic quadriplegia, can you just tell me what were the exact options here in this question? Spastic, and what was this, a single option or a multiple option? Was it a single or multiple option question? Tell me, first of all, spastic quadriplegia seen in, was this a single or a multiple option question? Single option, okay. What was the question? Basal ganglia infarct or calcification? Cerebellum infarct or calcification? Cerebellum calcification, okay. Calcification तो नहीं होगा newborn में. You may have infarcts, can happen. Basal ganglia calcification also there. So see, quadriplegia can also be seen in PVL. PVL can also cause quadriplegia, okay. And cystic encephalomalacia can also cause quadriplegia. Okay, so this is a slightly controversial question. Cerebellum agenesis is someone saying. Someone is saying cerebellum agenesis. So there was it all except. So remember PVL can cause quadriplegia also. Okay, cool. So remember we have discussed in your classes that preterms have white matter injuries, but term babies usually have gray matter injuries. Now someone is saying D was not in the option. Cystic degeneration was the option. Okay, cerebellar degeneration. not all except one option. Okay, so then we'll go for PVL. Okay, then PVL appears to be a better option. So remember, preterms में PVL causes dysplasia. However, even quadriplegia can also happen. Cool. चलिए, और आपको हर एग्जाम में बताया हमने कि व्हेन यू गो फॉर INICET फेब्राइल सीजर के 2 टेबल याद रखने हैं सबको. एक टेबल ये रिकरेंस का. एवरी INICET, whether it was last year 23, every JIPMER exam has a question on recurrences. You should know what is the risk of epilepsy. So ये 2 टेबल हम आपको हमेशा रटने को बोलते हैं. Simple febrile seizure is less than 15 minutes, 1 episode in a day. So this was the question. So all of you, tell me, am I right? These were the options, febrile seizures. 54% in non-febrile seizure, which is not right. Multiple option correct, single option correct. See, 54% is if there are 2 risk factors. That's the recurrence risk. 2 risk factors. In options A, age was there, 6 months to 6 years. No need for anticonvulsant in simple febrile seizure. True, accept. So, no need for anticonvulsant in simple febrile seizure. No need for long term, basically. They're talking about long term anticonvulsants in simple febrile seizure. This is also true. What is not true? So first option looks not true, rest everything is true. Now there's someone is saying CT scan bhi tha. Now all of you are confused in this question because you don't remember this question. It looks like not true about febrile seizures. Need for CT in a child with brain abnormality trauma. C and D was one option together. How can it be together? Now someone is saying a multiple option correct answer. Anyway, so A option looks wrong. Okay. C and D were same options. Not true, single answer. Anticonvulsants are used for managing simple febrile seizures? No. Chaliye, whatever it is, the first option looks wrong and rest are fine. Okay, we don't give long-term anticonvulsants in simple febrile seizure. This is the typical age. This is a typical simple febrile seizure. Okay, so I'll just take you to the last question, free flow oxygen. So remember in newborn neonatal resuscitation, we always discuss about free flow oxygen कब देते हैं? जब if the child is centrally cyanosed, he's breathing but he's centrally cyanosed. So free flow oxygen is given like this. This child is spontaneously breathing and we just put a tube here close to the mouth and nose. So it is given by a tube. Okay. Free flow can also be given by flow inflating mask, T-piece resuscitator. But remember, free flow is never given by a self-inflating bag. जो हम normal resuscitation में use करते हैं, we cannot give free flow oxygen from that. So remember, free flow is given by tubing over mouth and nose. Yeah, in the previous question, CT scan can be done in febrile seizure if you're thinking of other comorbidities. Normally, we never do, in simple febrile seizures, we don't do neuroimaging or EEG. Mask over face नहीं होता. Firmly placed over mouth is completely wrong. Face mask firmly will never be done. If the option is not true, A is also not true, B is also not true. Okay. Self-inflating, other was self-flowing. So you can give by self-flowing mask, but if there's only one option, was there an option of tube over the mouth and nose? Anurag. Every statement in this question had the mask held close to the mouth. Free flow not given by. So remember, free flow is not given by self-inflating mask. So अगर ये question था, तो your answer is, suppose it was not true. So remember, this is the most important point. We never give it by self-inflating mask. Okay, so all except question hai. So then of course, you should not give it by self-inflating mask. Okay. Loop tubing over the mouth. Of course, we can give it by tubing, but never by a self-inflating mask. So if it was not all except, there is no doubt self-inflating mask से तो बिल्कुल भी नहीं होगा. ठीक है? So if I say the question was, I can tell you the options. अगर आप मुझसे पूछो तो, your options would be flow inflating, because this is how it is written in our neonatology, book. Free flow can be given by tubing, flow inflating mask, T-piece resuscitator, tail of a bag. उस reservoir की tail से भी दे सकते हैं. So these are the exact 4 options. So remember, free flow oxygen is, if they ask not given via, so remember it should never be given by self-inflating mask. There is no doubt about this. क्योंकि उससे तो ऑक्सीजन ही नहीं निकलेगा. Okay, self-inflating mask cannot give free flow oxygen. Yeah. Mask over mouth, mask over face. So if the mask is around the mouth and nose, that's fine, but self-inflating can never give free flow. Okay, now we have got from tube close to the mouth, self-inflating reservoir bag. Yes, we can give it by reservoir bag. See, I showed you a photograph. We can give it by the reservoir bag. See, if you look at this photograph, this one, you can give it with an open reservoir. So I can tell you these are the options in your exam, जो कि हमारी किताब में है. Self-flow inflating bag, T-piece resuscitator, tail of a self-inflating bag. Okay, so remember this. Chaliye, now we have, someone told me there were 2 questions on dehydration. So can anyone tell me what were the questions on dehydration? Was it a question on best indicator of some dehydration in SAM? Near and over are fine. Ultra legends. Can you tell me about this question? Best indicator of some dehydration in SAM. Okay. Delayed skin pinch. Okay. So of course we know that in malnutrition, skin pinch, sunken eyes can be seen in a malnourished child. and this was what was the question? So Kawaljeet is telling 2 questions. Which of the following not seen in some dehydration? Okay, that's simple. Okay, so all of you, there were 2 questions. So I will just maybe copy this. So first, of course, you know, okay, so we'll not go into the details of that question, because the question was, what is not seen in some dehydration? Okay, what you can easily see. Increased thirst, lethargy. So thirst, of course, lethargy is not seen in some dehydration. Sunken eyes, skin peach. So lethargy is wrong. The rest is fine. Okay. Decreased urine output is also seen in severe dehydration. Okay. So this is a simple question which we cover in each class. So we'll not go into the details. Of course, thirst is some dehydration. Sunken eyes, delayed skin pinch can be seen in some dehydration. But lethargy and oliguria are seen in severe dehydration. Now what about best indicator of, so this is fine. Okay, वो हो गया. Some dehydration में क्या देखा जाता है? ये question हो गया. Multiple options correct. Now let's come back to SAM question. So guys, we had almost 25 questions of pediatrics this time. Okay, तो थोड़ा सा time लगेगा. We'll just take 5 more minutes. Okay. Okay, best indicator of, what was the question? What is not a best indicator of some dehydration in SAM? Okay. What is not an indicator of some dehydration in SAM? Does it look okay to you now? Was this the question? Or what is not seen? Most of you are saying, what is not seen in some dehydration in SAM? Multiple options correct. Okay, कोई कह रहा है SAM था ही नहीं. What is a reliable? So anyway, thirst should be the answer. If the what is an indication? What is an indicator? Then thirst is better. Remember, sunken eyes, delayed skin pinch can be seen in malnutrition. Most reliable indicator. Then thirst is better. We'll go further. Okay. Then there was a question on inhaled nitric oxide in PPHN. Okay, someone is saying I'm completely right. Sir, your options are completely right. So guys, within few hours, we have recollected with the help of you almost all of pediatrics. And I can proudly tell you, and I'm sure you'll agree with me, that most of this was covered in our classes. In every part of our class, I would suggest guys, just revise your notes. Everything is there in your notes. Now, inhaled nitric oxide is used in PPHN. Any other option you can think of? Or was this covered in pharmacology? We'll then go further. चलो किसी को नहीं याद आ रहा, it's okay. What is the most reliable indicator? You guys don't remember the question, okay? कोई कह रहा है most reliable, what not seen, but anyway, inhaled nitric oxide is used in PPHN. We know this. If you talk about unstable angina, then this becomes a medical medicine question, and erectile dysfunction is out of my syllabus, so we'll not talk about it. Okay, we'll not. Sleep apnea, but anyway, PPHN में use करते हैं inhaled nitric oxide. That I know as a pediatrician. Guys, I have no experience of the other stuff which was mentioned here, but PPHN में तो of course we use inhaled nitric oxide. Okay. So that was all about the recollection. Guys, feel free to tag me if you have any doubts, and just remember to revise your notes. Revise your PYQ, DVT and your notes. Everything is there. These were simple basics which come in every exam of yours, and we already told you. Okay, this was nothing new. So I did not find anything new in this exam. It was all what we always discuss with you. Okay, thank you. All the best.